My name is Dr. Brian Smith. I'm Chief of Surgery and General Surgeon here at Physicians Regional. I specialize in robotic hernia repair surgery and also laparoscopic gallbladder and anti-reflux surgery. Hernias in general are areas of weakness and bulging, either through anatomic weaknesses, such as in the groin or around the belly button, or through prior incisions in the abdomen generally. They can develop over time or very suddenly with coughing or lifting, and over time with continued lifting or straining or coughing can get larger. As they get bigger, they sometimes cause pain, and they can also cause some complications if the bowel gets out and gets twisted or stuck. If this happens, it can become very painful, or in extreme cases, it can actually cut off the blood supply to the bowel, which would lead to emergency surgery and maybe even a more complicated surgery. In general, the surgery entails opening and reducing the hernia sac and then placing a piece of mesh to close the defect. This can be done in a number of different ways. Often in my practice, this is done with a robot, so it's an outpatient laparoscopic procedure. But if the defect is large or too complicated for that, sometimes you need to have open surgery. The length of recovery varies a little bit if it's done open versus laparoscopically. But if it's done laparoscopic or robotically, for the most part, people are back to normal in about 2 weeks. The hernia repair doesn't really hit its full strength until about 6 weeks, but it's safe to return to most activities after about 2 weeks. For open surgery, it sometimes requires a stay in the hospital and can require a little bit longer to give it time to heal before you do anything strenuous.